The 1918 flu epidemic, also known as the Great Flu Epidemic or the Spanish flu, is considered the worst global pandemic in history, as it concentrated a high mortality in a short period of time. It's estimated that the mortality rate of the pandemic was between 10 and 20%, and that it killed between 50 and 100 million people worldwide. Like other flu epidemics that primarily affect children and the elderly, many of its victims were healthy young people and adults in their 20s and 40s, as well as animals, such as dogs and cats. The symptoms of this disease were high fever, earache, body fatigue, diarrhea, and occasional vomiting, and sometimes breathing difficulties and nosebleeds. Most of the people who died were the result of secondary bacterial pneumonia, as antibiotics were not available. However, one group died quickly after the first symptoms appeared, in as little as 2 or 3 days. The poorest people and populations suffered the consequences of this flu in a special way. But it also affected governors, such as the President of the United States, Woodrow Wilson, the British Prime Minister Lloyd George, or Kaiser Guillermo. The painter Edvard Munch even captured it in a self-portrait, and others like Gustav Klimt did not survive the disease. All the newspapers of the moment collected advertisements with miraculous remedies. The elixirs, medicinal waters, tonics, and other remedies stand out. Doctors at the time recommended aspirin, in doses now considered counterproductive, quinine, prepared with arsenic, camphor oil, or castor oil. Some even encouraged people to smoke, thinking that inhaling smoke killed germs. An Italian scientist, Professor Sacconi, claimed to have isolated the germ that caused the disease, but time proved it was not true. The strain of the virus causing Spanish flu, AH1N1, was not discovered until 1943, and its genetic sequence was not determined until 2005. Every day, Spanish newspapers picked up on the importance of hygiene education and how this task was carried out in Germany from schools and pupils, making the number of flu deaths before the war the lowest in all of Europe. They also warn that patients who do not experience any symptoms, the so-called convalescents, can be a focus of spread of the epidemic, so they recommended keeping them 1 or 2 weeks more in isolation. The use of cloth masks became mandatory for all those performing public service work. This measure was a health recommendation made to the rest of the population to prevent the disease from spreading so easily. The more contact there was between people, the more likely they were to reproduce the virus. The government is beginning to take preventative measures to try and stop this crisis. Theatres, circuses, workshops, factories and public places are disinfected, and some events are even suspended. The third and last wave was more benign, as many people were already immunized, giving the pandemic under control in the spring of 1919. And the disease ended on its own. By the summer of 1920, the virus had disappeared. While he won the battle against the weakest, the rest were immunized.